Good afternoon and welcome to our webinar, Competencies for Peer Workers on Crisis Triage Teams, hosted by the New England Mental Health Technology Transfer Center. I think, Rowan, if you don't mind bringing up the slides, perfect. Awesome. Okay, we'll get ourselves started. So just to do a few of our, I'm going to just go to housekeeping and then I'll come back and introduce our amazing hosts. Today, microphones are going to be muted. However, if you would like to join in the conversation when folks are, when Chris or Rowan will let folks know it's a good time to share, we also will enable you to unmute your volume at your discretion. Closed captioning is available for this event. I'm going to turn them on right this moment. And that will be available. If you need that, click on the closed captioning icon at the bottom of your Zoom screen to select the option that works for you. This session is being recorded and it will be available on the MHTTC website within 24 hours of the close of this presentation. Information about certificates of completion will be sent in a follow-up email. If you have any questions during the webinar, please use the chat or use the raise hand feature, and then that will have your microphone unmuted. And as well, if you have any questions after the session, please email newengland@mhttcnetwork.org, and we'll be able to get back to you as soon as we can. I'm going to go back to introduce our incredible people who are presenting today's event. Our presenters are Rowan Willis Gorman, she, they. Rowan is an experienced behavioral health advocate who is passionate about ensuring that everyone receives appropriate and equitable services when they are experiencing a crisis. They have 10 years of experience working as a peer and using their lived expertise to create and run creative youth programming, lead trainings, and advocate. She is considered a subject matter expert in suicide prevention and intervention, behavioral health issues and services, youth work, crisis services, peer support, and rural youth engagement. So thank you so much, Rowan, for joining us and hosting today's, along with Chris Locus, they, she, is a certified peer recovery specialist and certified trauma recovery coach. Chris worked as one of the first youth peers for Prince George's mobile crisis team. They supported the expansion and implementation of new best practices and played a critical role in helping to create a safe and equitable workplace for other peers. In addition to this, Chris also worked in assisting youth and young adults in long-term recovery and stabilization after the initial crisis period by leaning into mutuality and empowerment through a trauma-informed lens. During Chris's involvement, this program went from 0 consumers to consistently on or over capacity. So thank you, Chris, also for joining and hosting today's event. We'll go through just a little bit more of our housekeeping about our organization, the New England Mental Health Technology Transfer Center. Our funding comes from the Substance Abuse and Mental Health Services Administration, or SAMHSA. The views and opinions expressed in today's session are those of the presenters and moderators, not SAMHSA. And the New England MHTTC uses person-centered, affirming, respectful, and recovery-oriented language in all of our activities. During this session, please ensure that whenever you are contributing to our discussion, that you use language that is affirming, respectful, and strengths-based. Next up, as a committed ally, the New England MHTTC network recognizes that the New England area is home to the ancestral land of many Native tribes. Consistent with our values of community and inclusion, we acknowledge that all the places our distributed staff live and work, as well as where we provide services and hold events, are Indigenous lands. For our presenters explicitly today, Chris and Rowan are currently located in Piscataway and Susquehannock lands, and myself, Lee, I'm in Nipmuc, Pecumtuck, and Wabanaki Confederacy lands. So if you are interested in learning more about the lands that you reside on, you can utilize the website that we are going to put in the chat in just a second once I'm done talking, and then we'll be good to go. All right, and we'll move forward to our agenda slide for today. Those slides will also be available after today's presentation, so please don't worry about missing anything. They will all be available for you, but we will get started and I'll hand it over to Rowan.
Awesome. Thank you, Lee. Thank you so much for that introduction. Good afternoon, everyone. It's great to see you all joining in the chat. And I know when I was looking over registration, we've got folks from kind of all across the country, which is very exciting. We're so excited to have you here. As Lee said, I'm Rowan, and this is my friend and colleague, Chris Locus. You want to say hi, Chris?
Hi, everybody. Good afternoon. So happy that you were able to be here with us today.
We are really thrilled to have you here with us to discuss a topic that is near and dear to our hearts. Collectively, Chris and I have about 13 years of experience working in peer support. And before we kind of dive in, if folks could introduce yourselves, as you've kind of already been doing, put your name in your chat, where you're located, your pronouns if you would like, and tell us what your favorite self-care activity is.
Rowan, what's your favorite self-care activities?
Oh, that's a good question, Chris. I think it depends on the day, but I know that when I'm really busy, it's in the afternoon when I have the time cooking dinner for myself and my partner, and like having that dedicated time to just not think, make some good food, and then spend some time together. What about you, Chris?
I would say right now, because I am a collector of hobbies. So my current hobby is making the little flower Legos, and I'm really enjoying that.
I love that for you, Chris. And it's definitely making me think of one of my favorite TV shows. So thank you for that reminder.
Yeah.
So we've got some folks in the chat saying resting. Resting is definitely an amazing self-care tool, really essential. Michael likes to swim laps. Michael, I also love to swim, but currently I moved to a new place. I don't know where my best pool is right now, so I haven't gotten back into that yet. Sandra likes to meditate, love it. Leisure reading while pajama lounging, excellent.
Hi, I'm sorry, I can't do the chat because I'm driving, but my name is Katrina. I'm in the United States, in the state of Idaho. I'm a peer specialist on a crisis team, and my favorite self-care is probably music and my dancing in my car.
Thank you, Katrina. I love that. As I said, we've got folks from all across the country. I think we have a couple of folks from Idaho, so it's great to have you join us. We've got some dog walking, some shopping, a lot of dog activities, love it. My coworkers know that my cat sometimes likes to join my meetings and my trainings. So if you hear her come and join us, she will scream loudly. And that's just her talking about how happy and or hungry she is, but she is all good. So thank you so much, everyone, for taking the time to introduce yourselves. We're so happy to have you here with us today. We want this to be a really interactive presentation, so please feel free, as Lee kind of said in the beginning, to put any question that you have in the chat, or if you want to come off mute, just raise your hand and then ask us some questions. And we've got a bunch of questions for you to kind of help build conversation. So thank you again. And I'm going to pass it over to Chris.
Thank you so much. So we're going to start right at the top, talking about what a crisis is. And crisis is absolutely defined by the individual, and it can be varied. Autonomy is crucial in facilitating self-advocacy and understanding that individuals who are brought into the situation are there to ride beside the individual in crisis and not take the wheel. And so with that, that means that it is a subjective experience. So with the Crisis Now framework, when someone is in crisis, they are able to call a crisis center who will be able to offer them resources and referrals. However, if that individual wanted more support, that is where they would call the mobile crisis team, and they will come on, provide that hands-on support, which could lead to further short or long-term stabilization, depending on the situation. And with the Crisis Now framework, it really is about highlighting whole person wellness. How can we support people all the way through their situations of going through crisis and making sure they feel supported from the beginning to the end and after. So with 988, I would imagine a lot of folks have heard about it at this point. If you have not, it is the national number for behavioral health crisis. And depending on the area, when someone calls or texts, they will receive emotional support. And some of these can be peer-run warm lines. And essentially the difference between a warm line and a hotline is that the warm lines usually have set hours that they have. And so when you go on their websites and things like that, they usually have those differences labeled. And when 988, when you call in, you're able to connect to individuals to support in their area. And so that is also including mobile crisis support or an outpatient community partner provider. And they can also connect folks to longer term support. So back to what we were talking about earlier about that whole person wellness. And in my experience, one of the most jarring parts for individuals in crisis can sometimes trying to get reacclimated back to normal life, whatever their normal is, of course. And that is the prior to the crisis occurring. And so these longer term supports can really help with assisting people in further stabilization and their commitment to recovery.
Awesome. Thank you, Chris. So as kind of Chris said, there are three kind of different aspects of our Crisis Now framework and our continuum of crisis care. There's that someone to talk to. It's that person that you call in and have a conversation with, or chat or message in. Like Chris said, this can be either a hotline or a warm line. When I first started my career, I worked for a peer warm line for a couple of years. And I can say, after also staffing a hotline, they have very different kind of vibes to them. And a lot of times the folks that we had calling in for the warm line were really looking for something much more down to earth, more calm, just someone to kind of support them and engage with them. And being a peer and being able to provide that was incredibly meaningful and amazing. And I'm glad that we're seeing kind of a increase in making sure that that is a valid option within our crisis system. Then we go into the someone to respond. This is someone going out into the community, or sometimes even meeting someone at a stabilization facility to kind of make sure that they are getting everything they need, providing connections to them for resources, helping them feel not alone and connected, and building a very quick rapport with them. And then somewhere to go, which is frequently a stabilization facility, or at least that is kind of the ideal in our Crisis Now framework. So for folks with us today, do you see all of these different elements in your community, in your crisis of care continuum? Is there anything additional that you have in your community that's not on this list? Feel free to say it in the chat or come off mute.
I, I wasn't aware that these services, like the crisis center, the 988 number that you just gave, I wasn't aware of any of that here in Philadelphia. It's probably there, but until you brought it to my attention, I was not aware of it. So I think that more advertisement in regards to these services that are being offered should be more of it, like it should be advertised. Thank you.
Yeah, thank you, Sandra. And that's a great example that the 988 system, as it's kind of being built out and built up, there's still a lot of work to do when it comes to recognition and for folks being aware that it is a valid option, but also what comes along with calling into 988. And not all states have technically stabilization facilities yet. So we're still kind of building those out. Loraya is saying that they have them all. That's awesome. Carlton is saying respites. Yes, Carlton, respites are a really crucial part of the crisis system, but also our behavioral health system. It's amazing that you have that in your area. Not all states have them. So for the ones that do, that's amazing. Yeah, some of the services are stretched too thin due to high demands, definitely. I think we see that kind of across the country, especially with our crisis system, especially with more specialized services, whether they be for youth or for older adults. There just not being a lot of them or any, and therefore them being stretched incredibly thin. Megan is saying that Southern Oregon doesn't have a 24-hour stabilization center, only subacute. Yeah, we're still seeing a lot of states try to build these out. Kelly, it's awesome that you're seeing some kind of building of the stabilization facilities. Beautiful that Kentucky has all of them. Raya is talking about kind of the other aspects of a crisis continuum of care, case management, short-term case management, linking of resources. So it's awesome to see what folks have, but also it's a great reality check to acknowledge that not every state has a fully developed crisis system, and it's something that we're kind of collectively working towards. So I think we can all kind of acknowledge that a lot of these negative aspects that we see popping up still exist, whether it be that over-reliance on law enforcement, psychiatric boarding in emergency departments, traumatizing engagements on all levels, a lack of follow-up, and a lack of available needed support services and supports, or those services and supports being stretched really thin. Chris and I are both from Maryland, where we're seeing really devastating ER wait times for people in crisis, especially children. And we're also see our system, as a lot of states are, continuing to over-rely on hospitals to kind of fill all of the cracks. Our foster care system in particular.
Wait.
Go ahead, Katrina.
I'm sorry, I didn't know it unmuted me. I was talking to my dog.
You're okay. The foster care system in Maryland has really taken to placing foster care youth that they're struggling to place or support in the hospital, and then practically abandoning them. I think I've worked with some young folks in the past who, having a lack of broad awareness of our system as a whole, have kind of seen crisis as the place to start. One of them that comes to mind is a young woman who was struggling with some really intense suicidal ideation and wasn't sure what to do, wasn't sure who to go out to, felt like her kind of regular provider, her therapist, wasn't meeting her needs really well. And so she went to the ER. at the ER. She was hoping to get a referral for an IOP program or some other additional types of support, and was kind of surprised and shocked when she was told, okay, we're going to admit you to the hospital and send you to an inpatient stay. And if you don't agree to, we're going to involuntarily hold you. It went from a service that could have been, you need this, of course, let me help you figure out how to get access to it, to something that was incredibly traumatic for her and her family, and also placed a kind of unknown burden of money on her already busy life. That is Sandra, go ahead.
Yeah, so it went from a person that needed help that was in crisis to being involuntary committed.
Yeah.
So it that being by shortage of personnel or due to lack of information.
Yeah, exactly, Sandra.
Thank you.
Yeah. And I think it went from being a crisis that could have been very easily supported and uplifted to a larger crisis involving more people, taking more time, involving more money and more trauma. So what's something that could have been very easily fixed turned out to be something larger. So for folks kind of here with us today, do you still see any of these elements existing within your local crisis system? I know we had some folks talk about kind of services that do exist being thinly stretched due to need, but do any of these others still kind of pop up in your communities? Kelly says yes, with a lot of exclamation points. Yeah. I'm seeing a lot of agreement, which does not make me happy, but does not surprise me. I think as we continue to try to build out our system, we're still going to have these barriers that negatively impact people that we're going to try to build over. Raya says sometimes clients are detained when they are voluntary because no inpatient units are available. We have to detain and then send clients to our state institute. Yeah. That does not sound great, Raya, and is definitely not an effective use of our system. Kathleen says, yes, the system continues to traumatize people 100%. Yeah. I think we've also seen cases in Maryland where during the pandemic, we were seeing the psychiatric boarding take place to a really extreme degree, and we were seeing young people even die in the hospital because of it. So it has incredibly negative impacts, not just on individuals, but on entire families. Yes, Kelly, 100%. So as we kind of look into maybe a brighter future of crisis services, these are the principles that we see as being driving factors as we move towards crisis continuums that are more better suited to meet the needs of the people they serve, are more equitable, and don't actively cause trauma and harm to individuals. The main one being embracing recovery, and with that comes along adding really significant roles for peers at all steps of the crisis system. Making sure that staff and programs are trauma informed, creating suicide safer care, having safety and security for all staff and consumers, and creating crisis response partnerships with law enforcement. So these are kind of the principles that we used when building out our dream crisis system. Is there any that folks would add as a principle that they think should be in addition to this list? Go ahead, Sandra.
I think they should add also that we are to meet the consumers where they're at. Like we need to have that reminder, because sometimes, you know, we're so eager to help that we kind of forget that it's about them. You know, we just see them in crisis and not knowing how to really react to it. We don't meet them where they're at. Like, I think it was Chris that was saying, we're not there to take the wheel. We're there to let them do the driving. So I think adding that, meeting the person where they're at, would be also a principle that I would.
Yeah, definitely. Thank you, Sandra. So making sure that we're meeting folks where they're at, meeting their needs where they are, and supporting them kind of in that individual position. And I'm seeing Chris, Megan, Kilana, and Carlton all kind of talking about being equitable and equality focused, but also being culturally informed and culturally humble. So thank you. We'll make sure to kind of think of a way to kind of build that in, which I think are definitely kind of represented in the focuses that we talk about later. So I'm going to pass it on to Chris.
Thank you so much. When we are talking about the peer roles in crisis, it really does depend on the organization. And these are just a few examples. And what I really want to highlight is how extensive this list is and the different varieties in which peers can show up in spaces. I know a lot of time with the work that I was doing, I had to really advocate to be heard and seen as a professional and to be taken seriously within my work in crisis. And with this list, I personally had no idea that all these options were available within peer support. And so it's really important that we acknowledge that there is no glass ceiling with peer support. There are so many things and ways that people can support individuals. And this is a growing list. So if there is something that you do not see here, please feel free to put it in the chat, because when we don't know that the opportunities are out there for people, that is spaces where we are not able to show up. And so education is the best way for us to know that these things are out there and available. So if there are any other things that you would like to add, yes, harm reductionist, absolutely. Anyone else? Is there anything that people are seeing is missing? Cultural therapy. Okay. Valerie, I'm curious about what you mean by that.
Yeah, so where I live, I'm from the Lummi Nation. And so in our community here, a lot of connecting to self is also like connecting to our environment. And so we believe, you know, it's a teaching of our people that we have to keep our hands busy. And when doing so, once we kind of get to a place of a little bit more of a stabilization, I'll work with clients on our peers with cedar. And so just teaching them how, you know, a weaving technique and, you know, talking to them. And so it kind of opens the door for that communication and connection, not just with the peer, but also with their hands and what they're doing. And it's real, and it's almost like a cognitive behavioral health therapy tool, you know. And so that's one of the things, along with like looming on the loom with like yarn or wool. You just it brings out a lot of things happening in your mind, and it helps peers kind of find ways to reduce like their own barrier within themselves. with whatever challenge they may be experiencing. You know, it's at different capacities for each individual because it's so individualized, but it's the same tool, you know.
Thank you so much for sharing. That is amazing. I am so happy that you are there to facilitate and support individuals. And it reminds me how important culture is to us and how that is part of prevention, really highlighting that individuals are being benefited by being in community with others and having that be something that is highlighted and funded. And so thank you so much, Valerie, for sharing that. So the peer roles in the crisis continuum. And like I was saying, I really did struggle with advocating to show up in this kind of continuing the prevention, the response, and the post-crisis care. But it's something that I thought was really important. And I understood that in order for us to fully support individuals to meet them where they are, there has to be a connection on all levels with what they're experiencing. And so the crisis prevention is really important because we are talking about how peers can be useful in solidifying and supporting individuals who may be in tougher situations and may be prone to crisis or may have certain barriers. And those things, I would imagine, can be acknowledged with somebody who has similar lived experience. And so they can be like, oh, I went through something similar. I am recognizing some of the same lead up steps that happened to me maybe when we went through something. And so it's very important to have peers in there because they may be able to see things that others cannot. And also having peers run support groups and just be all throughout is so, so important, especially in the crisis response. And I will admit that this was the portion that I really had to advocate for, to have peers be at the moments of crisis and there to support. A lot of times those situations can get very fuzzy. There are a lot of people who want to be in charge of the situation. And I made it a point to always center the person who was in crisis. And a lot of times their voice gets pushed aside by all the individuals who are trying to lead and take over. And that's why I think it's so important for peers to be present, because we hopefully have that insight to always lead with person-centered care and to be trauma-informed and to make sure we're bringing the voices of the person back into the conversation continuously to make sure they're best supported. And the post-crisis care, which I'm so happy is in this continuum, because this is where I largely spent a lot of my time with crisis work, and that was supporting young adults who have now, quote unquote, been stabilized. But in reality, they were going through so many challenging things. Not only did they go through a situation, which some of them may have been their first mental health or behavioral health situation that they've ever experienced. And that alone, dealing with that is hard and tough. But then when you put school on top of that, if they were in relationships, they have friends, they have animals to take care of. And so now we're talking about how do we make sure that people feel supported in every part of their life so they can continue to show up as their best selves. And that's really what post-crisis is about, making sure people feel supported and taken care of so they can lead healthy lives and thrive in their recovery. And it's so, so important that we do not just leave people with the referrals and be like, okay, well, the crisis is handled and we've done our job. But in reality, there's more opportunities for us to lean in and really support individuals and to make sure they feel heard and taken care of, and to really stand in community with them. And I will send it back to Ron.
Awesome. Thank you, Chris. I want to build off one thing that Chris was saying about kind of that follow-up care. It is so crucial, like so crucial. I think it's I don't want to say standard practice because that sounds mean, but a frequent practice of hospitals to, when discharging someone that is kind of in that transitional youth age range of 18 to 26 or 29, really kind of leave them up to their own devices, give them referrals that might not even be in the jurisdiction or county that they live in, and let them figure it out on their own. And we've even had some of them, instead of trying to figure out, okay, where are you going after this? Who's taking care of you? Who are you going with? At most, giving them a bus pass, and sometimes giving them a bus pass to a homeless shelter that is completely out of their jurisdiction. I think there's a hospital in Maryland that has occasionally given transitional age youth upon discharge a bus pass to a homeless shelter in DC, which is putting them up in an area where they might not have any familiarity with, and kind of just setting them up to not succeed or be supported. So that follow-up care is incredibly crucial, and making sure that person doesn't automatically go back into a crisis state, which is not what we're supposed to do. We're supposed to help them and not set them up for more crisis. Thank you, Chris. So when we're looking at working as a peer in crisis services, there are kind of certain ethics that come into play, which also come into play in other areas of peer support. But what ethical guidelines do y'all think would be a priority when you're working as a peer in crisis services? And again, put it in the chat or come off mute. Do no harm. I like that, Megan. It seems very basic, but it also, I think, is incredibly true and almost a guiding principle. Setting appropriate professional boundaries, such as personal hours, availability. Yes, Michael, that's definitely, I think, a bit harder in crisis work. Given the nature of kind of crisis services, you aren't always working traditional hours. So figuring out what your boundaries are when it comes to hours can be really helpful to figure out. Lydia says, ethical responsibilities to ourselves as peers, self-care, awareness of bias and worldviews, being able to know when and how to ask for help. 100% Lydia, thank you. Accompaniment. Megan, can you tell me what you mean by accompaniment?
Basic, oh, pardon me, first time speaking this morning. Not leading, just being there to help them do whatever they're ready to do at that moment. And so really making sure that you're in step with where the person is at that moment. And like, what was her name? And Lydia said, checking your own bias, like what are you trying to do versus what is the person trying to do? So just being with them wherever they're at in their journey.
Yeah, Lydia earlier gave a great example. Thank you again, Lydia. Sorry, my brain just like hit the reset button very briefly. That is a great example. And I think a very kind of across the board ethical guideline for peers of not leading, not necessarily guiding, just walking alongside someone and making sure that they have the resources that they need to kind of accomplish their goals, maybe connecting them to a resource if they don't already have it in their toolkit, and supporting them through those transitions and those challenges. And sometimes just being the person to say, yeah, when I went through this, I came across the same barrier and it sucked for me too. Thank you, Megan. Remember to use cultural competency and cultural humility. Yes. Maybe ethical considerations that are specific to those of us working with young adults, especially under 18, and the age of consent to care. There's a lot of gray space in there. That's 100% Lydia. Every state has kind of different consent to care laws. In Maryland, our consent to care is 13. It just changed from 16 to 13, I think, last year. But Massachusetts, one of the states that I work in, it's 16. So knowing that and learning it is really helpful. I think something that I haven't seen folks bring up yet that I would just kind of try to acknowledge is that when you're working as a peer and you're providing crisis services, a lot of times you won't be working with an individual person. You'll be working with a family unit. Whether it be you're working with a child or a young adult or an older adult, or even you're working with an adult that has a partner and kids. So keeping in mind that you are ethically bound to support the peer that you're working with, but also you're going to have to navigate the family dynamics that come up in our work that can be especially heightened during crisis work. Awesome. And we're going to talk, I think Lydia brought it up about biases. We're going to talk about that a little bit later, but I wanted to point out that it is really, really crucial to acknowledge that. So some of the things that kind of we brought up were prioritizing the choice and voice of the peer that we are supporting and working with, which also does mean prioritizing their voice, whether it be within the crisis team that you're supporting or within the family unit that they're a part of, making sure that you're bringing up kind of what they're talking about. Maintaining a self-care practice. We all know how important this is. We can't pour from our cups unless our cups are full. So we have to pour into ourselves by making sure that we are maintaining a healthy and continual self-care practice. Practice creating healthy boundaries with peers. This can be really hard. And there are so many aspects of it that kind of come up. And there are so many ways to kind of develop this skill that we're going to talk about a little bit later. Advocate for continued education on crisis topics among my team. This is really crucial. One of the most amazing parts of being a peer is playing that role of advocator and educator. So when you're meeting with your team, when you're meeting with colleagues, talking about new topics that you've seen kind of come up in the field, or maybe in a interaction that you had with a peer recently, but kind of bringing it up and making sure that it's kind of at the forefront. Kathleen is kind of highlighting that of continuing to learn new skills. Identifying and recognizing personal issues and topics that may impact my ability to act as a peer in a crisis setting. This will be different for everyone. And you'll identify that kind of some of these topics are ones that you're like, oh, I can't work on this. If this comes up in a case, I have to step away. I have to call someone else in. It'll be too much for me. It'll impact my ability to kind of properly support too much. And there'll be other things that you'll identify and say, I know this, and I can work around it. For myself, I know that I have a pretty intense bias about hospitalization, especially with youth. I've seen the impacts of it. I wrote a paper kind of talking about how hospitalization really negatively impacts young people. And I know that, but I also know that when I'm playing the role of a peer and I'm working on a team and I'm providing services to someone, it is important to kind of have that knowledge. And it doesn't always need to be the driving factor. I can put it in my back pocket and just walk around with it. And ensuring that my team is providing focused on autonomy. This is really important and kind of a crucial aspect of the ethics of working in this, but also in some of the core competencies that we're going to talk about later. Lydia has a great note in the chat. Expectations need to be written down and clearly established for everyone involved. 100%. We should be working from kind of a shared understanding of ethics. For kind of autonomy, it is really crucial because sometimes folks will have different priorities within a team, especially when you're going maybe to pick someone up from the hospital or provide them peer support while they're kind of in a hospital setting. And you can still be the person to kind of focus on autonomy in that setting as well. Okay. So now we're going to dive into our core competencies. I want to give a little bit of background over these before we kind of go into them. These are our 5 core competencies for peers working in crisis work. We conducted a really thorough literature review on peer support in crisis service settings, conducted an expert panel of 18 peer leaders from kind of across the country that talked about their perspectives on peer roles within the continuum of crisis care environments. Then did 15 interviews with folks that were working in crisis service environments as peers. And those interviews were really focused on kind of actual tasks and skills that were needed by those peers in their roles. And the core competencies were kind of built out of all of that work. Okay. I'm going to pass it off to Chris.
Thank you. And I would like to add, in addition to what you were saying around, let me just go back a few real quick. Identifying and recognizing personal issues and also building on what Lydia was saying, I would like to highlight that in an ideal world, you should be able to set expectations and talk to your teammates, your colleagues, and your higher ups. I would also like to acknowledge that that may not always be the case for individuals. And if you do not feel safe to highlight or talk about your boundaries with everyone on your team, even finding a select few that you can talk about with may be helpful. In my experience, it was me and one other young adult peer, and we had conversations about our own, we called them no-nos. And so we had those conversations and we had like a keyword that we would use in the moments where we were like, this is beginning to get into an uncomfortable place for us. And the other person knew to kind of step in and take the lead. And so I just want to highlight that it is okay to find something that feels good to you, even if it's not directly and explicitly saying your boundaries to everyone you work with. So yes, let's get into the importance of using empathetic and supportive language and highlighting empathetic and supportive relationships. Of course, listening and responding in a way where you are really trying to hold what the person is saying in a way that is caring, in a way that shows that you believe them is important. And always, the idea of expressing curiosity, the thing that comes to mind is to have open-ended questions and really allow the person to open up about their experiences and leaving space for them to speak. And using that non-judgmental, yes, active listening, absolutely. And that's why body language is so important. I know that with a lot of times when we would enter rooms with young adults who were in crisis, one way that I would establish empathy right off the bat was acknowledging that I was in their space and thanking them for allowing me to be in their space, and acknowledging how uncomfortable that could be. And that's also part of building support and rapport in general. But acknowledging that moment can really help with them seeing that I am being empathetic towards the situation in general. And then moving into calming strategies. Of course, every situation is going to be different. And so knowing what tools you have ready, but also knowing where you may need to have more education about calming strategies can be very helpful. The non-threatening body language, if it is something that you are comfortable with, even role playing with your coworkers to just see how you show up in a room. You may not know that you may use certain things or you move certain ways, and it doesn't make it a bad thing, but it can be something that you can take note of and improve on. And also making sure that, like Ron was saying, we're being mindful of our biases and how we show up, and always trying to lean into the positive parts of things. I do say that with caution because, of course, leaning into a positive regard is good and helpful. And people experiencing crisis are allowed to feel a variety of feelings, and all those are also good and helpful. So with that, is there anything else that people would like to add in regards to showing up and engaging people in an empathetic and supportive way? Feel free to put it in the chat or come off mute. Yes, absolutely. Validating their feelings. That is always very important. And while I'm waiting for others to share, I'll build on what Sandra was saying in regards to active listening. One thing that I found to be very important when we are implementing those strategies is that we take the time to acknowledge if we are just listening to people to respond, which is a natural human thing to do. It is nothing wrong with it. But in these cases where we're really trying to lean in and make sure we're being present, letting go of that responsibility on your end to have the answers and just be there to listen will really allow you to be present in the moment and take that pressure off you to have the answers. A lot of times, in my experience, and what I personally believe, is that everyone has the answers inside of them if you give them the chance, opportunities, and resources to navigate them. And so, yes, it can be hard, but we can do hard things. So a few ways that this can show up in practice during intakes or when you're first meeting a peer, using that empathetic body language and facial expressions to ensure they feel supported and heard. Absolutely. I really try to, in the first interactions, because honestly, that is one of the things that are going to last with individuals. And it is important that, in my experience, I was trying to show up as a person who was on the same level as the individual that we were in crisis with. I'm not saying that everybody has to do this, but it was very helpful for me and for them to acknowledge that, hey, we're kind of in this together. I don't want you to have to look at me as this all-knowing professional being. I really am just here to support you in the ways that you need it. And leaning in with that empathy and showing up in that way was always very helpful and receptive. Another way, asking supportive and curious questions when trying to learn more about a peer and what circumstances may lead them to be in the crisis. Absolutely. And also ensuring that we focus on the needs and wants of the peers you're supporting and trying to meet their goals and needs. And I will add with that, making sure that the peer is included in making the goals. A lot of times that is not always the case, especially with young adults. A lot of times they feel like things are happening to them and they're just being told what to do. So as much as we can include them in the process of setting their goals, it will help to build resiliency, but it'll also give them some stake in what's happening and provide them with that reassurance that we are in this together.
Chris, can I add on to like the body language section?
Please.
So I think one of the things that I've learned in my practice is if I stare at someone 100% of the time and try to make like the most eye contact, that's super overwhelming. So trying to like make sure that I'm getting an understanding of that person. Do they like eye contact? Is it making them uncomfortable? Do they seem to be like, is it communicating care and like emotion to them, or is it like crossing a boundary? Also about like how you're holding your body, keeping your hands and like arms within sight so they're not someplace that someone can't see, like behind your back. Trying to look engaged but also not hyper focused. That can be really overwhelming, especially for someone in crisis. And kind of figuring out like what is the best facial expression that I can make for this person. Like, do they want me to be smiling and seem like happy to be interacting with them, or is that coming off as being insensitive? Do they want more of like a flat affect, or is that coming off as being hard to read? Or should I be kind of mirroring them with a little bit of concern? This is all super nuanced and I think takes a lot of practice to figure out what works best and requires a lot of like pivoting in that exact moment, but I think can be really helpful when kind of developing out this skill.
Absolutely, Lauren. And I will add on to take some of the pressure off of ourselves. You can also ask if there are certain ways that make the person feel more comfortable. Would you like to stand over here? Would you like to sit? Is it more comfortable for you to speak while we're walking? Would you rather write things down? Like those things and those interactions, you can, yes, self-awareness is important, and you can really, like I said, take it as a team effort just to kind of take the pressure off ourselves to read people 100% of the time. So with developing connection, the skills quickly build rapport and connection in a short time frame. And what I think is really important when we're talking about developing connection is how we lean into being authentic and making sure that that is coming across. A lot of times it is difficult to engage with individuals if they know that you're not really rooted in authenticity. It will be highlighted, unfortunately, yes, especially the youth. I was trying to say it in the nicest way possible. And so the way that we really root ourselves in that authenticity is to make sure that we are taking the time to care and learn about the individual. It can stem from a true place. And so using that active listening to understand the person and their unique situation, but also trying to learn more about them besides what is going on right in that moment in the crisis, maybe asking them what they like to do. What were they doing before? How do they like to spend their time? Those are ways that you can develop connection in an authentic way. Yes, absolutely, not manipulate or force. And also, what can be really important when appropriate is to have that mutuality of things that you may be interested in together. I have had experiences where individuals who are from different generations, they're very worried about how to interact with the youth and Gen Z. And what I like to tell them is that if you show up as your authentic self, it was only up from there. A lot when they were speaking to me, they were like, oh, well, I don't know how to use memes and I'm not sure exactly how to speak with the youth. And I think that you don't have to try to change the way that you present and how you speak with individuals in that way in order to show up authentically. I think a lot of times people will appreciate, yes, Sandra, when you are just being yourself. And I think that is how you can develop a sincere connection and focusing on the strengths and the skills and the moments that they are being kind to themselves, the moments where they light up, really acknowledging those things, especially during a crisis, can be very important and can help to reground the situation. And when I really think about developing a connection and what was very helpful when I was speaking with young adults is always looking at that person as an individual person, understanding that people are not a monolith. Like I have met this one young adult and this one young adult only. And yes, they may have similarities to other people, but this is an individual person. And so trying to make sure I'm showing up in an authentic way for that person and allowing them to fill in the gaps of their lives and how they show up can really help with developing that connection and also acknowledging what biases I may hold before going into those spaces. What am I thinking that this person is going to show up as before I even get there? And when you're able to acknowledge those things, you're able to then show up more authentically. And so there are a few ways that this can show up, like we already talked about, when you're meeting a new peer in a crisis call, in a variety of settings, and also when you're trying to stabilize and help someone calm down. If there are situations where individuals may be standoffish and are not in a place to be calmed down, I think it's also okay to acknowledge that, to validate people's feelings, and to make sure that we are being present to what is actually going on and not just what our goals are. Like, yes, we would love for this person to quote unquote calm down, but is that actually what they need right now? Or do they need someone to have their back and maybe say, yeah, that is messed up. I'm so sorry that you're going through those things. So making sure we're actually following the flow of what's happening and not stick to a certain rule book of how things have to go when you enter those situations. And I will pass it back to Ronan.
Thank you, Chris. I think just echoing what Chris is saying, you don't have to kind of follow a guidebook or a timeline. If someone needs more time to like talk about the things that they're going through and have you validate them, that is okay. And it is what they need. There's no like set prescriptive schedule, like, okay, we spend 20 minutes calming someone down, 20 minutes on like resource development, and then we're good to go. So do things kind of in the flow that they show up and be as flexible as possible, which peers are already pretty good at doing, our training really kind of highlights those skill sets. Awesome. So our third competency is supporting people experiencing crisis to participate in kind of that decision making. This means that you're doing that active listening to understand that person's preferences, their needs, what resources are already available to them, what resources aren't available. Are there any that they specifically kind of want or don't want? Figuring out how we can kind of expand their options, brainstorming together, identifying those natural supports that already exist and they have access to, and planning for resolution and kind of looking ahead to it. So when we're doing this kind of supporting folks to participate in decision making, this shows up in a bunch of different ways. It shows up in advocating for a peer's choices and goals as they navigate the crisis system, and ensuring that your team members are kind of also acknowledging and working towards those goals. And I think also acknowledging the boundaries that exist around those goals. There was a young woman that I worked with once who was kind of in and out of hospital systems, in and out of ERs perpetually, going in and out of a state of crisis. And the thing that she continued to say was that she didn't want her family involved. When they were kind of brought into interactions, they really triggered her and kind of set her up for another period of crisis. And that she didn't want to interact with male doctors, specifically male doctors. These, I think, seem like really easy goals for us to acknowledge and stand by. But we continued kind of whenever going in to the same ER. It wasn't a different one, it was the same one. The ER staff would continue to kind of disrespect her kind of boundaries, and particularly the boundaries that I was sharing kind of as the peer, that she didn't want to interact with male doctors. She wanted female doctors, and no, don't call her family. They don't need to be involved in this. But it kind of took the voices of other team members to say, these are our boundaries, backing her and myself up to make sure that she was being listened to and that she could move out of that state of crisis and work towards her goals. We're also kind of looking at supporting that peer in brainstorming options when seeking services. This can mean that you having a really in-depth knowledge of all the different services and resources that exist within your community, but also what services and resources exist outside of your community virtually. So what support groups are you providing access to? Do you know like about your local Hearing Voices support group that maybe exist in person or online that you can connect them with? This is kind of about that, knowing the best knowledge that you can, not just about the crisis system, but about the system as a whole. Does anyone have any kind of example of where they've seen this competency show up in a crisis scenario they've been in? Thank you for sharing Hearing Voices in the chat, Lee. Chris, I saw you smile. Did you have an idea of like where you've seen this competency show up?
Yes, I have. I was thinking about a specific situation where I was assisting a young adult after having a crisis, and they were speaking about their experiences of feeling, well, actually, of knowing that they were being followed, and also having a previous trauma of being shot at. And I had to, like you, Rowan, work overtime to have their feelings validated, where the clinician on staff wanted to say that they were being delusional and wanted to diagnose them with one of those specific mental illnesses. And I had to validate their experience and support them in saying, no, these are real things that this person has experienced. And I think what the peer role is very beautiful about it is that when we take that time to advocate for peers, especially in the moment, it really is showing them how they can advocate for themselves and take up space. It's one of my favorite ways to support people.
Awesome. Thank you so much for sharing that, Chris. We also have Valerie in the chat talking about helping an elder find the right space for living as he was challenged with living in his van. Yes, that is 100% a scenario that comes up a lot. Supporting the individual in developing or using their crisis plan. Yes, love that. Lydia says, understanding the decision making as a skill. Youth have a lot of providers, lots of services, may not have a ton of practice in making decisions for themselves, and it can be super overwhelming. Yes, Lydia. And not only is it a skill that it's important that we kind of help them develop, it's also super developmentally appropriate. Young people, kind of as they grow up and spend time with their families, are having plenty of opportunities where they're doing that back and forth of making decisions, learning how to kind of make choices in a supportive environment. So it's very developmentally appropriate for us to support them in this setting as well to make choices. Thank you, Lydia.
Hey, Rowan.
Hi, Charles.
How are you all doing up there?
Good.
One of the things that comes to thought for me is when I'm, conversing with a peer, is to try to stay focused on their attributes. What can I see in a positive way, and while they're thinking about something, or they decide to chat or something, and trying to focus on their attributes, and then kind of secretly reveal that I've noticed in this high quality about you, and it works. Instead of looking at what's wrong with them, what can I find, what can I see that's right about them? What do I see that's positive about them? And sometimes it's, of course, if it's, male peer and all, is if it's really rough, and I begin to look at the attributes and see things that they, they might not notice in them, and say, hey, let's go take a walk. Let's go out here and walk around the sidewalk and around the building. And then while we're walking is, notice things about the scenery. Notice things about, if you pass by others, do you see attributes in them? And that's amazing sometimes how that works. And the biggest thing is getting that person to have a positive thought about themselves instead of what's wrong with me. So I'll give it back to you.
Yeah, that is very valid, Charles. That kind of building up strengths and assessing strengths with folks can be really beneficial. Of taking the time to be like, hey, Chris, I've noticed that you are amazing at making others feel really good about themselves. I've noticed that you are an amazing artist and you're so creative, and kind of identifying those positives and those strengths can really help folks kind of feel empowered and supported. Thank you for sharing that, Charles.
You're very welcome.
Williamette is saying bringing their voices and choices to the center of the care team is a way to protect human dignity. Yes, we are big fans of the concept of prioritizing the voices and choices of folks that are receiving services. And it's a way to kind of make sure that the services that they're receiving are the kind of best options for them. Michelle, who is phone only, is saying it's important not to diminish people's hobbies. Yeah, people are quick to diminish gaming or tech they don't understand, but they're important to those who care about them 100%. So if you're having a conversation with someone and they keep bringing up hobbies that maybe you're not familiar with, you don't do yourself, but you can tell they're really important to them, building them up and kind of talking about, it sounds like you really enjoy that, or it sounds like that's a priority to you. It's something that like you really need in your life to feel good and to feel supported. Or this sounds like something that you're really good at. So making sure that we're kind of uplifting those things that not only we identify as strengths, but they identify as strengths as well. Awesome. So our fourth competency is advocating for self-determination, which again, we kind of earlier talked about how peers are by nature advocates and educators. It's one of the main roles that we play kind of in our work. We see this kind of skill showing up in expressing curiosity about the choices that our team is making, upholding person-centered practices and principles, and presenting other options, which is kind of partially about knowing your system really, really well. I think I had a great example of advocating for self-determination from my mother. When I was a kid and experienced my first mental health crisis, I was EP'd and sent to the hospital and spent kind of a night in the emergency room and kind of noticed my mother, who is a social worker by training, kind of express curiosity about the choices that the team that I had were making for me and about me without having a conversation with me. And she heard me continually say, I don't want to be in the hospital. This isn't a good fit for me. It's not going to benefit me. It won't go well. And advocated for that and advocated for my voice and my choice to kind of be the primary driving goal in that crisis scenario, and really made what could have been an incredibly traumatic crisis situation into something that I can look back and say was not necessarily beneficial, but something that I learned a lot from and I got a lot out of, and it turned me into a very insistent advocate. So it does show up a lot here, and is really important and can have lasting impacts for folks. So we see this core competency show up in kind of, I don't know who said it earlier, but reminding team members that choice and voice needs to be the priority when we are providing services to someone. That needs to be the thing that we continually go back to. Supporting your team on focusing on person-centered principles and educating them in a kind of our peer practices and our peer ethics. And making sure that all options are presented to someone when they're making a choice. We don't present the options that we think are right for them. We present all of the options available and make sure that all of them are gone over, all of them are discussed, and that we aren't just kind of limiting their choices because we don't think they'd like that one, or that's not a good fit for them. We let them make those decisions for themselves. Awesome. I'm going to pass it back over to Chris.
Thank you. And I would also like to add, in regards to self-determination, is when we are in those positions where we're able to advocate for the peers, especially if it was something that was not done directly in front of them, going back and educating them about what that experience looked like for them, what will look like for you as an advocate, what things you pulled from, what knowledge you have, and how they can do those things in the future is a great way to build that self-determination, because ultimately we want them to be able to do that for themselves in a supportive way. And so any type of ways that we can support them in education, especially around the healthcare system, a lot of those things can feel so convoluted and confusing. And so any time that we can take to be like, oh, this is how I break down this specific document that you're looking at, and understanding what's happening to you or what they're saying about you, or etc., can really be helpful in building that self-determination. So yes, team resiliency, which is one of the most important core competencies. They are all important, but I do have a slight lean towards this one, because at the end of the day, if we are not taking care of ourselves, we will not be able to show up best for individuals. And a lot of times when we talk about self-care, I think it can become a buzzword, especially now. And so I would like to acknowledge that self-care can be anything that you would like it to be. If that is getting out of bed during the day, or eating, or whatever is something that you are dedicating your time to, that can be self-care. And it can help with promoting that team resiliency, connecting with your colleagues when it feels safe to do that, always being mindful that you do not have to share past what you're comfortable with in order to fit in with a team, and also participating in the team meetings and the debriefings. And I would also like to acknowledge that in order to, I think, practice great team resiliency, we as leaders can encourage people to have great work boundaries. And that means acknowledging when they are off, reminding them like, hey, I know that this is the time that you are ending or supposed to be ending. How can I support you? And making sure we stay to that time. And also mirroring that for individuals. And so if you are in a position of being higher up, also implementing your boundaries and stopping work when you're scheduled, and highlighting the things that you are doing for yourself, and really being mindful that people are looking at you and how you show up in these spaces. And if they see that you work overtime and work during the weekends and you answer your phone all the time, and you are elevated to this higher level, they will think that that is what they should do in order to be at that same place with you. And so acknowledging how we all show up in these spaces and making sure we're making room for individuals to actually practice good self-care. I think a lot of times we say, oh yes, we want folks to have a good work-life balance, but what are we actually putting in place to make sure that that is accessible for everyone? And so does that mean we need to hire more people, that we need to acknowledge how we are setting out the tasks for individuals? Is there ways that we can move work around to make sure things are more equitable so everyone can have time to rest and recuperate? And so with that being said, some other ways that this can show up in practice, talking about self-care openly and as a team, and to bring it up with the peers that you're interacting with. And building rapport with team members can make collaboration with supporting peers easier and more fruitful. And so essentially when we are, a lot of what peer work is, it does really lean from our personal experiences and how we show up in the world outside of work, a lot of that translates over. And so if we want folks to advocate for themselves, if we want to show that they can take up space and that they can practice their self-care, an important part of that is acknowledging that we can do the same thing and showing up in the ways that we wish that they are able to show up. And when we are able to take care of ourselves in that way, we will then have more team resiliency because we can then show up as better people, hopefully leading lives that feel more connected and healthy within your perspective meaning of that word. And also, it is crucial with crisis work that we are trying to be very in tune with ourselves. Crisis can be exhausting and overwhelming, and it can be a lot to take on, especially if you are somebody like me who tends to be very empathetic and can sometimes take things in like a sponge. Being mindful of those things and how you can best support yourself allows you to be a better teammate. And I'm curious if there's anything else that folks are thinking of that could promote team resiliency, and feel free to put that in the chat or come off mute. Yes, team fun, absolutely. Having time to just be and exist outside of work, yes, I agree. From Michelle, I learned about the idea of congruency in social work. This means that you value behaviors that are the same at work and in your personal life. Yes, absolutely. An annual wellness retreat. I love that for you. I'm so happy that you have that. Kelly, I'm curious what area you're in. And can I go to the retreat? Is this an open invitation? Okay, Ohio, okay. The communication among team members with boundaries in place, absolutely. Thank you guys so much. I will pass it back to Rowan.
Thank you, Chris. Chris, the next time that we do a team retreat, I will definitely try to get you up there to join us. Although I don't know if it will be as relaxing as the annual wellness retreat that Kelly and her team has. But I can definitely promise some amusement and lots of jokes. Awesome. So before we kind of dive into our breakout groups and our case study section, we want to give y'all a little bit of a break. We know that you've listened to us talk for a really long time. So we're going to do 5 minutes. And Lee is very kindly sharing our case studies in the chat. When we come back, we'll kind of put you all into breakout groups and assign you one of the case studies. And you will discuss it and talk about where the competencies kind of show up. And then upon coming back, be ready to kind of discuss. Yeah, let's do a quick 5-minute break. As I said before our break, we're going to step into our breakout rooms now, and we're going to go over some case studies. Lee is going to put us into 5 different breakout rooms. Lee, how many folks would we have per room if we did that?
We would have about 4 to 5 participants for each room.
That is perfect. I think Lee will label our rooms 1 through 5. And then while we're in our breakout rooms, Lee will do a screen share with a document with our different case studies. So if you are in group 1, you will be doing Toulouse. If you are in group 2, you will be working with Charlize. If you are in group 3, you'll be supporting Devon. Group 4 is working with Sarah, and group 5 is working with Alden. These are all different case studies working on different things. Your kind of job is to, as a group, think through them, read through them, discuss where the competencies kind of show up and how you would support or advise in that individual case study. When we come back, we will debrief each one collectively.
Welcome back.
Hey folks, welcome back.
I think we have some folks that are going to take the breakout room ride back. So we're just waiting for them to be sucked back in.
I'm just checking if everyone can let me know via the chat if they can see the case studies still on their screen.
We can see them, Lee.
Cool.
Awesome. Beautiful. Thank you, everyone. Welcome back. Thank you for sticking with us. So like we talked about kind of before we went into our breakout groups, we're going to do a debrief now. And we're going to go kind of section by section. Excuse me. Scenario by scenario, rather. So to start, could our number 1 group talk with us about Toulouse?
Would it be helpful for folks if I read out the scenario first, and then we can get into the breakdown? Or has everyone had the chance to read through and take a look at the different scenarios?
Group 1 did read, and Michael, Michael, are you able to do the reporting? The debrief?
Sure, I can do that. I took some notes.
Good, okay.
Yeah, Chris, if you could read it off quick for everyone's sake, and then
I sure
I'll run
can.
through our ideas.
Okay, great.
Perfect.
Lou is 29 years old and has struggled with passive and active suicidal ideation for most of their life. They've spoken about this at length with their current therapist and have set up ways to check in with their partner and mother about when they need additional help. They've been struggling more recently as they've begun a new job, which is a night shift at a tech support company. Their suicidal ideation has become more active and intense as they have been having a hard time adapting to a new sleep schedule, and a recent fight with their partner has caused them to spiral and make a plan to end their life. Toulouse decided to reach out to their therapist, who then called Mobile Crisis to come and check in on them. Toulouse is firm that they do not want to go to a hospital, but agree they do need some kind of support. How would you support Toulouse through this crisis?
So some of the things we talked about here were to starting with open-ended questions, looking back at the fight that seemed to cause this spiral in crisis, what was going on there, especially because that partner was formerly a contact that they had, that they were willing to reach out to in times of struggle. So kind of looking at what happened there, maybe connecting with mom since she still remains a contact that's available to this person. And then asking too, what are some other contexts, other people, other supports that are accessible at this time? What might be places of safety, seeing as the person doesn't want to go to the hospital? What other places are available? Certainly making a point of validating the struggle, especially once you know more about the fight that precipitated all of this. Maybe the person needs to go through a deep breathing exercise, or someone suggested getting out for a walk if that's available, and trying to break away from the environment and the routine that's holding this person in a moment of crisis, and allowing a change of scenery, perhaps to allow a change of mental state for the person. And then the last thing that we noted is you're going to be wanting to check in with the clinical team in your mobile crisis unit, because we did talk about here in this case study of a plan for suicide. So looking at how accessible are the means, and are there steps that need to be taken with regard to that? So those were our notes there.
Awesome. Thank you, Michael. That was incredibly thorough. I loved all the elements that you touched on, kind of looking at those previous contexts that were identified as being good options to kind of check in with. The change of scenery might help with some de-escalation and some kind of new environment setting. Also kind of talking about managing means and making sure that someone can remain safe in their home where they want to be, while also making a crisis team feel safe and comfortable letting them stay there. I think the one thing that I might kind of add is that new job of transitioning to a night shift. That can be really dysregulating for someone. So what might you like, how might you bring that into your check-in with Toulouse? What might be something that kind of pops up on that element for y'all? And this is open to team one, but also kind of anyone.
I think if I kind of got some indication from the person that they were comfortable, I might share some of my experiences with sleep and work and some of those patterns, just to kind of establish some other possibilities and ways of thinking about it.
Awesome. Thank you, Kathleen. Sandra, I saw you come off mute too, and I wanted to make sure that you had something to add, you had the chance to.
No, but I was thinking in regards to the work, she pretty much covered it, like give an example how night work does deprive us of sleeps, which can make us irritable, which it doesn't really help when it gets to the health and to the mental issues. So, if they giving them a little food for thought that, maybe that would be something that they would like to look further into in regards to transitioning off of that night shift, which is probably a problem for them.
Awesome. Thank you, Sandra. Chris, do you have anything to add on this one?
Yes, I wanted to highlight the beauty of Michael saying the deep breathing exercises. I am a full supporter of embodiment and trying to reconnect folks back to their body. And I think with this type of situation, when they have a lot of things going on within their relationship and they're not getting enough sleep and they already have a history of suicidal ideation, there may be some disconnect there. And so going through those breathing exercises or any other type of embodiment exercises can help reground Tolu and what's going on and allow them to safely feel their feelings in those moments when they have that support. And yes, but everything was great.
Awesome. Thank you, Chris. Let's go on to our second one. Wait, Michael, I see your hand up.
Yeah, if I could ask a follow-up question to this. Let's say there are members of your clinical team on your mobile crisis unit that are advocating for an involuntary intervention because of the risk of suicide. How do you go about navigating that as an intermediary? You're both advocating for the consumer while at the same time trying to be a member of the team. How would you go about that?
That's a good question, Michael. Chris, do you want me to dive in or do you want to? Okay. So Michael, you are not alone in this. I think every crisis staff person that's been a peer that I've ever worked with has kind of had a similar question or scenario that's kind of come up for them. I think it really kind of goes back to the very basic ethics and basic principles that peers kind of embody when doing crisis work, is trying to prioritize sorry, I need to quiet my phone. The choice and voice of the peer they're supporting, but also being on a team of folks that might have different priorities, especially when they're coming from a clinical view. I think some of the ways that kind of come up for me in how to address this, you already kind of touched on means planning. So asking this person if they're comfortable telling us what their plan is, what means are involved in it, how can we limit access to those means? Is it something that we can entirely remove from the house, whether that be pills, guns, knives? Is it something that they need to be in a different location for? Is their mean very specific to a certain place or activity? And can they go and stay with a family member or a friend where that means does not exist for them? There was a young woman I worked with who her ideation was very specifically attached to jumping off her balcony. She lived in a apartment building. She was on the 10th floor. So one of the things that we kind of came up with to make sure that she didn't need to go into the hospital, but the clinical staff were still kind of comfortable with it, was her going to stay with her brother, who lived on a ground floor apartment that had no upward levels. It was like a 1-floor apartment. So limiting access to means is a great option. I think some folks will kind of suggest that you bring in safety planning, but I know that that really depends on the person and the relationship that you have with them. I think also a lot of this goes back to the education that we do for our clinical team. Talking about kind of those alternative options of looking at means assessment, but also doing pre-education with our clinical team. I don't know if y'all are familiar with the alternatives to suicide model. I find it really beneficial, and I am someone who has struggled with suicidal ideation, both passive and active, for pretty much my entire life. And I found that it can be a really great education tool, especially when working with clinical staff, who I think to kind of be more on the anxious side of wanting to make sure that someone is safe. So doing that education and making sure that folks kind of have an awareness of the impacts of hospitalization, whether or not it's truly necessary, and ways to kind of go around it. Does that answer your question, Michael? I know that was a lot.
Yeah, super helpful reflection there. Thank you.
Yeah, of course. Okay. we want to go on to number 2?
Yeah, let's go to number 2. I will go ahead and read. Charlize is a 50-year-old woman who works as a lawyer, has a wife and 2 children. As one of her children have recently started to experience some behavioral health struggles in school, and it's been really stressful for the entire family. Charlize in particular has been struggling and has been having a difficult time finding healthy coping skills. She's begun drinking and has started to self-harm in moments of intense stress. These coping skills calm her down immensely, but make her feel incredibly guilty and shameful afterwards. After drinking to excess and cutting herself to a potentially dangerous degree, Charlize asks her wife to take her to the emergency room to receive medical care. You were called in to meet them at the emergency room. How would you support Charlize through this crisis? And any folks from room 2, please feel free to debrief with us.
Okay, so the way I wrote it out for Charlize is I would start off with open-ended questions. I would also use motivational interviewing. I would introduce myself, ask them how they're feeling and how can I help. So it would be more of them telling me what it is what area I can help them in. Depending on what she says, I would ask about her drinking and how often. Depending on what probably she's gonna say, I drink because of my child's behavior and I don't know how to deal with it, but when I drink, this is what calms me down. So my next step, I would ask them, do they think that they have a drinking problem? Because that's where they're going towards when they have to deal with the child. And they would probably say no, they don't think they have a drinking problem. They only drink because they want to deal with the child. So I would then introduce them to emotional regulation, which is the dialectical behavior therapy. And I would explain to her, I would try to explain how we are able to, once we recognize what it is that we're going through, we have to learn a new behavior to replace the old behavior. So when she's feeling stressed, instead of drinking, maybe she could do just sit back and do some journaling of why she's stressed, which would help her get that out. Or if she has a support system, to be able to speak with them in regards to a stress situation at that time. After that, I would be giving her resources in regards to finding a therapist. I think it would have to start with her first because of the fact that she is using the coping skills she's using is more harmful, which in turn getting her situated would then help her to get the resources for the behavioral health that's needed for the child. Because during that time, she's learning new coping skills. And by going into therapy herself, she would see how it would help her, would introduce it to the child, and eventually have a family therapy where they would all be included in it at the end. And then I would stay connected with her to make sure that she is being guided to the correct resources and help her out as much as possible. That's how I would have handled it.
Thank you so much, Sandra. That was so thorough. Is there anyone else from group 2 who would like to speak any more to something specific or anything they would like to add on?
Thank you, Chris.
Devin is a new team member on a mobile crisis team. He has been working as a certified peer support specialist for 5 years and recently finished a training on crisis situations. Since he started work 8 weeks ago, his team has engaged in numerous high stress and triggering situations, including one which involved an individual in an intense state of crisis that was very verbally combative with the team. Devin is very aware that his team is approaching burnout and is worried that another high stress situation could push them all too far. How would you support Devin and his team in this situation? And I will pass it on to the group. What are some things that we are thinking of that could be in support of Devin, be in support of the mobile crisis team in general?
I think that to assist Devin, um, first of all, he's noticing that there's burnout in his team, and he's worried that it could push them too far. So I think for him being on the team would be for him to encourage them and give them the information about self-care, like explaining situations of what's going on, explaining how he's feeling. So that way that they're able to identify if they're feeling the same thing as him and suggest what are things that he does for himself as a self-care to give them ideas of things of what they're able to use in self-care, because if they are not able to regenerate themselves, they're not able to help anybody else. And that would be a point that I'm sure that he would tell them. So I think that that would be one of the areas that he would be able to help us out.
Absolutely, Sandra. That is such a good point to bring up, that considering he is new on the team, he may be noticing some specific team dynamics that others may not see because they have been in the work for longer. And so Devin taking that time to bring up what he is seeing within the team can be very useful and beneficial. Is there anything else that folks are thinking of ways to support Devin and his team?
It sounds like they need one of those Ohio team retreats we were talking about earlier.
I would agree with you.
I was thinking of the same thing, Michael. Actually, something that also came to mind for me was there was a crisis team that we worked with in Indiana that I think did an amazing job of supporting each other, and it included peers and clinicians and administrators and some medical staff as well. And they had a really great approach to kind of approaching burnout as a team, and kind of talked about almost that kind of no list that you talked about earlier, Chris, where as a team, when they would notice that burnout was happening, or either for themselves or for others, or just notice that they had had a bunch of really high stress cases, like one after another, they would kind of call it out to each other and make sure to have a conversation as a team to both kind of review and reflect on those cases, but also have that conversation of, what are you doing for self-care? What's working for you right now? Are there things you need to add? Are there things that like aren't working anymore? And additionally, this team also started doing 4-day work weeks. They had multiple teams and we're doing 4-day work weeks to ensure that folks had kind of enough recoup time, which I know is a logistical burden to some and can be really daunting, but I can say that it worked really, really well for this team in Indiana. So I'll hype it up wherever I go.
They should have a plan for everywhere to set it up that way. That sounds really interesting. Some type of like a blueprint that can be shared.
Yeah, I agree, Sandra.
Rowan, I think what you're bringing up is very important. The idea of constantly reevaluating the systems that are in place within your organizations, and to ask questions. Just because there are certain ways that things have been done doesn't mean they always have to be that way. And you are allowed to take up space and speak about those things, especially if you're noticing that they're harming or not helpful to how you are able to show up and work. Does anyone else have anything to add, Rowan?
Nope, I was just going to echo you, Chris, and talk about how crucial that aspect of the work is and how it's very intrinsically peer to do that.
All right, well, we will move on to group 4. And to give folks some time, I will read aloud. Sarah is 67 years old and has been homeless for 25 years. Before becoming homeless, she worked as a teacher and was married to her husband since she was 23. During most of the year, she avoids the shelters due to a previous trauma that has occurred at one when she was first starting experiencing homelessness. It's the middle of the summer and it's reached a dangerous heat. A homeless outreach worker has called your mobile crisis team to ask that you help her convince Sarah to go somewhere indoors with air conditioning. When you arrive, Sarah is very activated and upset and seems unwilling to speak to your team. She is insisting that she cannot go to a homeless shelter. What can you and your team help Sarah? Is there anything that is coming up for individuals in this situation?
I think Kilana is saying in the chat that we could offer to bring services and support to her instead of making her go to a location against her wishes. I love that, Kilana. I will fully admit that when I wrote this case study, that did not occur to me. My brain did not think we could move the mountain to her. It thought of all of the other options. So I love that you thought of that.
I also think when they are older in the senior, and she's been homeless for 25 years. I am doing my internship at a site that is for the homeless population, mainly men. But in this population, the way it's set up is that the therapist, the nurse, everything is in the home for them. They don't have to go out to receive their service. That was a place that I've never, excuse me, I didn't know that even existed, that they were doing that. I know they wanted to incorporate at one time that all medical services and therapists were in one, everything was accessible to the consumer in one spot, but I didn't know that it had already been done. So at this site is where they have that offered. I think that if explaining a situation like that to them would be something that they may want to agree to, because the mission of the facility itself is for them to never be homeless again. The main part of everything is their aftercare plan. They make sure that they have their housing, they get bills, they get their furniture, they receive everything. They get all set up. If they need to receive SSI while they're in the facility, they can stay there as long as they want, as long as it takes for them to get their own housing. So I think if we have more opportunities of building structures like that and have facilities for in the different age groups, because I think a mixture of young with old is not a good combination, but having their own individualized sites like that, I think that they would be more susceptible to even thinking about it, because they might even want to check it out. Oh, really? They're going to get me a house and I can stay there as long as I want? Like, that's something that you rarely hear as a resource for them.
Thank you for sharing that, Sandra. 100%, those services do exist, and it's amazing that kind of we have communities where those options are available. I do want to point out that for some folks that are chronically homeless, they don't want a house. They don't want a home to live in. It's not something that is a need for them or a want for them. So how do we support the folks that are chronically homeless and do not want to seek a home? And I want to kind of point out that Valerie in the chat is talking about coordinating with additional agencies that offer water and ice daily. And Kilana is saying listening and asking the client what they need. It's simple, but I found that it helps folks assess what it is they're really needing, wanting in that moment, and also helps spark a deeper conversation. 100%. What is it that Sarah wants or needs? Does Sarah want or need air conditioning? Or does she want to need like ice water? Does she want and need a home and a place to sleep? Or are her concerns about accessing food and medication? What are the things that she cares about in this? Thank you, everyone. Does anyone else have anything to add?
I would like to add that in this type of scenario where you come on the scene and the person is activated and upset, this is a great opportunity to kind of take them away from the situation and have a private conversation with them, and really leaning into validating their experiences, especially if you're walking into a situation where Sarah is ultimately trying to be forced into something that she does not want to do. It's a great opportunity to validate what's going on and apologize on the behalf of the coworkers or the people who are there who were not listening, and really saying that you are there to listen and to be present for Sarah.
Awesome, Chris. Yeah, Sandra is kind of echoing you and saying, showing that empathy.
Absolutely.
Let's go on to number 5, and then just do our kind of final stuff for the day.
All right, I will go ahead and read through. Okay. Alden responds to a crisis situation with his team where there are multiple individuals who are experiencing high levels of distress and fear due to a sudden loss of a family member. When they arrive on the scene, there are multiple emergency personnel, including police, EMTs, and firefighters there, as well as many bystanders watching nearby. Alden and his team can hear one of the individuals screaming at the bystanders for watching, clearly upset by the large number of people involved in the chaos of the scene. How would you recommend Alden proceed in this situation? And I will open up the floor to anyone in group 5 who would like to speak or type, whatever is comfortable for you.
Well, there are only 2 of us in group 5 and neither of us are peers. So I kind of want to just ping pong it back to either you as facilitators or any other peer to put their perspective in, because my group had a fine time talking about it. It was great for us, but really trying to like elevate and highlight like peer voice in the training for how they would respond. I'd love to hear that.
Awesome. Thank you. It was Ginger and someone else. I didn't see your name. I apologize.
Oh, it was me. It was the one who was talking. Megan.
Megan. But yes, this is Ginger. And again, yeah, I haven't had experience exactly like that. And it didn't specify exactly what our role was. And that's something that Megan had brought up as far as coming on the scene. So just really assessing the situation to try to help where Alden could in that situation.
Yeah, thank you. I think for most of these, we're looking at being a peer member on a mobile crisis team. That is a good question. I see Kilana in the chat saying this one is tough. Alden could ask the individual nicely, not to escalate or heighten the situation, but this is a very 50-50 on the outcome. I think you're very right. This was not an easy one. And I see Sandra has her hand raised.
Thank you. I think that the first thing Alden would do is, because there are police there, I would ask them, could they move the bystanders back, because making the situation worse instead of making it better. I think that once they start seeing that people are moving back, then him and his team can start approaching the individuals that are agitating, introducing themselves, asking them what's going on, how can they help them, that they're there to help them. They're not there to have them arrested or anything, because now once authority is involved, they kind of get more agitated. So we have to de-escalate the situation because it's already been escalated. So the best way is trying to get them maybe back into the house to speak with them, to calm them down, because they can also see that now the crowd is not in front of them, and it starts bringing down the testosterone, as we say. And the approach has to be a soft approach, because we are dealing with individuals that are very agitated, so they're angry. So, you have to, that's like a timing approach of when you're going to speak to them. If they look at you, they acknowledge you, then that's your opportunity. Hey, how you doing? My name is so-and-so. I'm just here to help you out. We're not here to cause any more trouble, just trying to figure out what's going on. How can we be of service? And I think that would be able to, one of the ways to help them out.
Awesome. Thank you, Sandra. I think you're right. You have police there, so finding a way to have them be kind of a helpful part of this, not activity, but event, having them create kind of a border away from the family, which Kilana is kind of also talking about. And I want to echo something Kilana said, because I think it's a really important sentence, but you're not just kind of keeping them away for privacy or for your own comfort, but it's to keep the view of the public away from them and their loss. Because that's what this is. This is a scenario where there's been a loss, and I think we can all imagine and even remember how traumatic and upsetting a loss can be, and how much worse it would be if you were being witnessed and watched. Yes, Sandra, showing respect. And Valerie made an awesome comment as well, that sometimes we don't have words that comfort a sudden loss, and that is okay. And it's okay to go into this space and not be sure what to do, and kind of focus on sharing space and providing comfort if possible. Chris, what comes up for you?
I think everything that has been said has been extremely helpful. I love the idea of trying to separate the family and giving them that space. And once again, bringing in that empathy of that person being upset instead of trying to reprimand them, acknowledge that their feelings are valid. I am a huge proponent of all feelings are good feelings. And so allowing that person to experience whatever they're doing, but maybe moving them to a safer place for them to experience that can be very helpful. And yeah, I think utilizing the police is very, very smart. I think we've kind of hit all the major things that could be very helpful for Alden and the team. I will also add that checking in with Alden after would be beneficial in this situation. With this case study, this is something that came from my personal experience when I was on a team I was on the mobile crisis call when dealing with someone's family who had a sudden loss, and it was very jarring. It was one of my first experiences being out with individuals. And there was a lack of support, in my personal opinion, upon coming back. And maybe that has to do with the fact that this, at their point, they have been on multiple teams and multiple calls in regard to dealing with that. But in my experience, it was my first time, and it was really difficult to regulate myself after. And so acknowledging what just happened for the individuals who are supporting is really important, and not assume that everyone is just okay and ready to go on to the next thing, and making sure that everyone feels supported.
Thank you, Chris. Thank you for sharing that with us. Awesome. I want to move on to our next section because we're about to wrap up. Lee, can I take back screen share?
Go
Beautiful.
for it.
Let's do the thing. Okay. Ah. Okay, there we go. So we've talked about our competencies. We've talked about some scenarios where they're going to kind of pop up. What are some tools and practices that you think could help you increase kind of the skills and competencies that we talked about earlier? And feel free to come off mute or put them in the chat like we have been this entire time.
The practices that I think would increase my competency skill in this area would be more of learning how to continue and act how you brought those different scenarios, because we normally don't go through things like that. So having information that will give us the practice for different scenarios like that and breaking it down, I think it's very useful to improve our competencies, because I would have never thought of those type of scenarios. You know, we always think of like whatever we're normally seeing around us in our environment, nothing out of the box, as I would say. But I think this type of training and that type of use of scenarios and asking us to how we would react to it is a very good practice for us.
Awesome. Thank you, Sandra. I'm a big fan of case studies. I think they give us a chance to kind of exactly what you're talking about, learn about different scenarios and situations that we might come up against in a really kind of safe setting, and give us a chance to think about all of the elements that will be involved. And I think if you're in a team and you have the chance to kind of do this type of case study work, you can also talk about, okay, who do we know that will be involved in this? What EMTs, what firefighters, what police officers, what nurses, which hospital are we going to be at? What's interacting at that hospital look like? You can be more kind of practical in that application when you're doing it with a team. And I know that role plays are scary. Case studies are way less scary than role plays. So that's why I like using them. Michael put in the chat, yeah, Chris, you brought up a great point about case debriefing. Practice makes perfect, and having open, constructive and validating discussions about past cases will offer a space to learn and prepare for future scenarios. Exactly, Michael. Case debriefing is kind of a really crucial aspect of tools and practices that we can use to further develop our skills. You have the ones that we have listed here. Role playing obviously is a good option, but I know that it's scary for some people, myself included. So case studies I find to be a really good alternative to that. Another one is kind of practicing explaining your role to family and members and friends. Orient them to what it is that you do as a crisis peer. What's your job? What are you going to support them with? Orienting is really crucial to kind of anyone in any role, but it's especially crucial in crisis settings. Further develop your understanding of the system in your area. What exists? What doesn't exist? Are there virtual options that do exist that are a good kind of replacement? Kind of practice. So practice orienting folks to what you do, kind of as we all do work to further develop your understanding of your behavioral health system, what exists as options, what doesn't exist. As Williamette said, use your toolkits, figure out what's in there and what isn't. Network with other providers, kind of build up your relationships so you can more easily call upon folks when you need to. And practice your communication skills with teams in practical ways, but also in fun ways. You can do this with role-playing games. You can also do it with more silly things. I think something that comes to mind is the communication games where someone is blindfolded and the other person is supporting and guiding them. There are ways to do this that aren't boring and not fun. We can find fun ways to kind of grow our skills. Okay. I want to be thoughtful of time. Crest, do you have anything else to add to tools and practice before we wrap up?
I think you hit on everything perfectly. I will also just add that if there are things, especially when we're leaning into biases that we hold, that may start to make you feel a little uneasy, those are really opportunities to lean in and explore what is actually coming up for you. I know a lot of times those feelings can be uncomfortable and we tend to push them away. So I just would like to highlight that when your body is telling you something, that can be a great opportunity to explore what is going on, and it can then lead to you finding more tools and practices to help sort through those feelings.
Thank you, Chris. I want to echo something that Charles is saying in the chat, that self-assessment tools can be really great things to use to kind of build our practice. I want to kind of mention that before the end of September, we're going to be having a listening session for folks who have worked as peers in crisis services to review our self-assessment tool. We would love if you could all come to join that. You'll see an announcement come out shortly. We will be providing stipends for folks who attend that and participate. It's just been great to spend this time with you all. Thank you so much for joining us and talking with us. I know crisis is something that I care a lot about, so I'm really glad to have had this time with y'all. Chris?
Yes, absolutely. Thank you so much. I am open to staying in community with any and all, so please feel free to reach out to me. I will put my email in the chat. And I also want to thank you for continuing to show up, to continue to be in spaces like this, to participate and to listen. Thank you for the beautiful and sometimes hard work that you do in this world. It all matters. Thank you for continuing to be here.
Yeah, and if I can add just to finish up, I've added into the chat the survey. We would love it if you could give us feedback on today's event. As shared, it was presented in partnership with New England MHTTC, and as a SAMHSA funded organization, we're pleased to have the opportunity to evaluate our services. So if you can complete that, we would appreciate your honest anonymous feedback, which will provide information to SAMHSA and assist us in planning future meetings and programs. Your feedback counts. Attendees providing their email address will also receive this survey after the close of today's event, along with a link link to the video archive and slide presentation. And for more information, please contact the New England MHTTC and or the presenters who were so wonderful in presenting today. And I hope you have a great afternoon.